Hello everybody and welcome back to my channel. My name is Dr. Bree and I'm here to help you build a more resilient body and mind. Today I'm going to be teaching you how to use a pelvic wand like this one. This is from Intimate Rose and these are great for so many different things. Just like you might use a lacrosse ball on your upper trap or a foam roller on your hamstring, you can use a pelvic wand in order for you to better self-massage or self-release your own pelvic floor in between physical therapy sessions or as maintenance after you no longer need PT. I am a big believer that everybody should be empowered to learn how to self-care and self-manage. I don't want my patients to always be dependent on me. I want them to feel like they have the tools they need to manage should symptoms flare up again in the future. So let's go ahead and get started and I'm gonna show you how to use this. Before I go any further, I just wanna have a little disclaimer here letting y'all know that I might be using some terminology. I realize that our body parts are so heavily gendered, especially by the medical community. So you might hear me say things like vagina or vaginal tissue, things like that. But I'll also try to use other terms that my patients prefer, like front part or front hole, anterior part, outside part, things like that, back part, back hole. I want to recognize that this can be a really triggering experience for some folks, and unfortunately trans folks and gender and sexual minorities have lower rates of getting preventative care, and due at least in some part to the lack of competency by providers and just how disaffirming the entire experience can be. Even packages names being, very feminine or in pink packages, things like that. So I just want to put this little disclaimer out there, but this video is for all people, not just cis women. Everybody has a pelvic floor, which you'll see when I talk about this little model here. So we can move along. This is nice and clean. You can use toy cleaner like you might use for toys, or you could use just gentle soap and water as well. This one I really like because it's made of silicone as opposed to plastic, so it's a little more soft. Sorry, there's a dog barking outside. Okay, I think they're done now. But so you want to make sure this is clean, make sure your hands are clean. If you are concerned about infections like UTIs and whatnot, you can always wear gloves, of course. And you also want to make sure you have lubricant on hand. The lubricant that I really like to recommend to my patients and that I like to use personally is something called Slippery Stuff. I don't know if you can see that, or there's another one here called Sliquid Satin. They have a variety of different types of lubricant. I'm not sponsored by any of the products in this video. These are just things that I recommend to my patients. So the things that we're looking for in lubricant is one, I want to make sure that it's water-based, not oil-based, just usually less irritating to the tissue. And two, we want to make sure that it doesn't have any glycerins or sugars, things like that. It usually gives like a little bit of a gritty texture, and the idea typically is that it actually ends up drying out your tissues more, so you have to use more lubricant for the same effect. And there's some debate as to whether or not it can actually contribute to things like yeast infections. The evidence on that is not super clear yet, but just to be safe, you do want to avoid it. And since this is covered in silicone, or if you have any silicone toys that you use, you don't want to use silicone lube. There is a benefit to silicone lube because it's not absorbed by the body, so you don't have to just keep applying more and more, whereas water-based lube will eventually become absorbed by your tissue. So you do have to apply more. However, if you use it with another silicone device, it could degrade the material. So just want to be careful. You spent money on it, you don't want to degrade it. Once you've got your clean wand, your clean hands and or gloves, your lubricant close by, you want to make sure that you're in a nice, comfortable position. So most people, including myself, can't just lay flat on their back and be able to reach. And that's because you have to use your core in order to do that. My arms are super short. I have the little T-Rex arms. I won't be able to reach comfortably. And when you engage your core and you're kind of sitting up, you're putting pressure and probably engaging your pelvic floor as well. So what you want to be doing is laying semi-reclined, preferably with pillows under the knees. Some people like to keep their feet flat or even their legs out straight, depending on what's comfortable for you. Generally, you don't want to be like knees out and just totally relax, even if you have that flexibility, because it does add a little tension to the pelvic floor. So I'd recommend, fold up a towel, have a bolster, a yoga mat, something like that. In this position, the idea is that you can reach, but you're relaxed. And that's also the idea with this wand, is that it has kind of an optimal shape so that you can maneuver better than you would if you were just like using your finger or a toy or a dilator, if you're familiar with those. So if you've already gone to pelvic floor PT, you might be familiar with a model like this. Unfortunately, I left my other models, ones that are meant for people with vaginas, back at the clinic, but this will do because, like I said, everybody has a pelvic floor. So just a little refresher. And I am going to post some videos about anatomy of the pelvic floor as well, just in case you're interested, and the different functions. So just a little refresher, this is the outside part. So this is a pubic bone here. This is your coccyx or tailbone. These are your sits bones, those like hard bony butt bones. And then this is the perineum. Okay, so this is for someone with a penis. So we have a muscle here down the center, one over here, and then one that goes across this perineal body from one sit bone to the next. And we can actually feel these externally. The way I learned them was like the YMCA. So one is tucked in like this, one is out really wide, and then one, well, I have a wall here, but then it kind of goes into a T shape. But those are ones you can feel externally. And then internally, we have all of these different muscles, and they're almost entirely the same regardless of your gender or your genitals, okay? So we have all these different muscles, and this is just the anal opening because this person does not have, the model of this person would not have a vaginal opening, but you can feel so many muscles, okay? So depending on the muscle that your physical therapist found that was the most tense or overactive or painful will depend on what you're working on. So this one here has two ends. This one is supposed to be a vaginal end, or for the front hole. And the idea is that it's kind of got the same shape and hook as the finger. So when I have a patient and I'm doing an internal assessment or treatment, I can kind of insert my finger one knuckle depth at a time to go to different layers of tissue. And then I can move around. And it's the same kind of like angle and point, sorry, this way, same kind of angle and point. However, for some people, this might still be too much girth. So in that case, you can use this end, which is technically a rectal end, but you can use it anywhere. So this patient here would be using the rectal end. Let me show you the inside actually. And so when they insert it, they can then do the same thing with their wand that I do with my finger. They can wrap around, etc. Okay. So something specific for someone with with two orifices, so with a front hole and a back hole with the vaginal opening, when you insert it, you do want to be careful to avoid the urethra. So let's imagine for a second, pubic bone, tailbone, anal opening, there's a vaginal opening here. The urethra would sit right above it, okay? And so when we insert, I always recommend to people that they insert and they kind of give a little bit of a downward push. So when they insert, they're kind of scooping down, and we're trying not to abut on that urethra. We had a dog earlier, and now we have sirens. Well, I live in a medical district, so what can you do? Wait for them to pass. That's what we'll do. Laying there, you have your legs propped, you have all your stuff, and when you insert it for the first time, it's really important to not go too far. So this is a little pointy here, and that helps doing your own trigger point release. But when you first insert it, don't go too far. Go about as far as you would if you're going one knuckle depth in, and make sure that you are taking a nice deep breath in and relaxing as best you can as you insert slowly and gently. So it's not uncommon to feel some discomfort or maybe even a little bit of burning. Again, we want to stay away from the urethra though. But it's not uncommon to have a little bit of discomfort. So it's a little arbitrary, but I say less than a 3 out of 10 pain. And it might be different for you. So my 3 out of 10 is probably not your 3 out of 10, but we want to keep it pretty low in severity. Another good analogy that I love to use is a stoplight. So 0 to 3 is like your green light, keep going. 4 to 6 out of 10 pain is your yellow light. So maybe slow down, take a break, don't use as much pressure, things like that. Don't go as far in depending on where your symptoms are. And then the red light, which is like a 7 out of 10 pain or higher, is your stop. We don't want to keep going. And it's not necessarily because we're worried about damaging your tissue. It's more so that we don't want to make this association between the brain and the body that insertion is painful, because most folks, well not all, but most folks who who are noticing this pelvic pain, they might be having pain with sex if they engage in receptive sex, whether that's in the front or the back. They are having pain with penetration, either superficial or deep, or having pain with putting a tampon in, things like that. And so we don't want to create this association like a Pavlov's dog type scenario where we assume that penetration equals pain, if that makes sense. So you've inserted it. You can go ahead and go like this again. And you might hear different providers tell you different things, but I think you can insert in a few different directions. So some people prefer to insert like this, where we have this little curve. Some people like to insert in this direction. And I think it really depends on where your symptoms are and how you feel that you get the most control with the wand. So we'll insert slowly. We'll find a space that's a little tender, and then what you might be what you might not expect is that the wand can move quite a bit, to the extent that when you're using it, it might actually, there's a hair, there's a hair here, it's my hair. It might actually hit your other leg, and that's totally okay. All right, so that's why we have the legs supported and kind of moved out of the way. So we're sliding it. Okay, we find an area that's a little tender, and you can hold there just like your physical therapist might while they're working on you. And I like to start with just gentle holds and not too much pressure. Again, holding and closing the eyes, ideally in a situation where you don't have a lot of distractions. So there's not a lot of loud noises going on, like the siren and the dog that we heard earlier, or there's not a lot of other, just a lot of other stress and distractions. Like all your senses can be fairly calm. Maybe have some like light music going on. I like to use a little diffuser for like aromatherapy at the same time, just to help get me in that calm, relaxed, parasympathetic state, that whole like rest and digest, very zened out. So you can start with some gentle pressure, and then once you can tolerate that, when you're using the wand, you can add a little sweeping motion. And sometimes this is called Thiel's massage, sweeping. If pressure at all is too painful, you can simply just insert it and allow yourself to become a little desensitized to that. So just putting it there, giving your body time to acclimate, which is similar to what you might do with a dilator, but again, with these kind of pointy tips, you can be even more specific. And then over time, you'll be able to go a little bit further, add a little more pressure. I also really love using a technique called contract relax. So if you've been to PT, you might know what a Kegel is, a pelvic floor contraction and a pelvic floor relaxation. I'm gonna post some videos on how to do those too, because those can be kind of not so intuitive motions to learn how to do. I have to use a lot of different cues with my patients to get them to kind of find these muscles. So you can do Kegels and reverse Kegels with the wand. You can even keep the wand in place and add some movement from other parts of the body. I really love doing like a moving the leg from side to side. You can slide the heel out, bring it back in, do some pelvic tilts, so many different things, so many options. Last but not least, even if you don't necessarily need release or self-massage or self-manual therapy, you can still use this to help you learn how to find these muscles. So some of us have a really hard time engaging this musculature until we have something to contract against. So you can use the wand, hold it up against the pelvic floor, and then it kind of gives your brain that cue of, okay, contract against this pressure, or relax and elongate against this pressure. So self-tactile feedback, I'm a big fan of, especially for folks who maybe aren't super comfortable using a little mirror to get that visual feedback to look at themselves, etc. Okay, so that concludes all of the tips and tricks of how to use a pelvic wand to help self-manage your own pain and do some self-myofascial release. I really hope that you enjoyed this video. Thanks for sticking with me until the end. I really love talking about this stuff. I'm an educator at heart, and so if there's more content that you would like to learn about, more things you would like to see related to pelvic floor or PT or powerlifting or LGBTQ issues, please do leave a comment, give this video a thumbs up, and hit that subscribe button. And feel free to share it with someone who you think might benefit from it. I wish that more of us talked about this issue. As always, thanks for watching.